Hey everyone, welcome to this 62nd edition of ClariTea Chat. Today we have with us Kumar KV, Group CIO of Narayana Health, India's leading healthcare provider that treats over 2.6 million patients every year from over 78 countries. Hi Kumar, welcome to this session.
Hello, Jagdish. How are you? Cheers.
Yeah. So Kumar, I know you're a man of data, so tell us a little bit more, some more data points about Narayana Health.
Sure. We have headquartered in Bangalore. We have around 44 healthcare facilities. We have around 19 owned and operated hospital, one hospital in Cayman Islands, couple of managed hospitals, four heart centers, 18 primary healthcare facilities. And from a capacity standpoint, we have our overall bed capacity is around 6,300 odd, out of which around 6,000 beds are, we call it as operational beds. We cover around 30 plus specialties, and we have a 17,800 odd strong workforce comprising of doctors, nursing, paramedics, and administration. So that's a quick snapshot about Narayana Health.
Yeah, that's actually really, I must say, enlightening because, many of the people know Narayan. NH means Narayan Hrudayalaya, which was the heart care. And when you say 30 plus specialties means it has really come a long way in terms of being a more comprehensive healthcare provider.
Absolutely.
I always I read a case study about Narayana Health in it was a Harvard case study which I read and we discussed it in the class in our Ahmedabad days, and and after that, whenever I connected with you, it was always with a lot of curiosity about what is NH all about. So I'm sure we will learn more about NH and your strategy, but of course, about you as well. So, just to introduce Kumar, Kumar belongs to a humble family, always believed in education. He's an alumni of Satya University, Tamil Nadu, completed his executive education from IIM Bangalore, MPhil from BITS Pilani, and currently he's pursuing his PhD in digital health. We'll talk about it more, what makes him do it. His rich experience of 20 plus years spans digital strategy, innovation, system design and development, planning, enterprise architecture, security, and privacy. And he has been driving digital transformation and implementing high performance, scalable, and secure digital solutions for customers and now for NH. So, what we will cover in our discussion today is a few topics, which really define how Kumar has grown in his career and life. So one is being a sponge for knowledge and new experiences, being hands-on with disciplined hard work and a strong value system, seeking mentors and being a mentor, uh, gratitude for mentors as well as paying forward for that. Investing in the horse, which is capability, hard work, customer delight, and trusting the cart to follow, roles, compensations, recognition, etc. And simply means that he never went after any roles or compensation; it just came to him, and he invested. He was always investing in himself. Customer focus and delivery excellence earned him the trust of leaders and got him the roles and new experiences and new challenges. And of course, we'll talk about the aligning the technology strategy to organization vision and strategy at Narayan Health. His philosophy is pull up people in the organization, pay forward, build an empowered organization so that decisions can be taken even in your absence.
Sure.
As always, we will end the chat with a rapid fire round to bring interesting notes from Kumar's story and then his reverse question too. So let's hear this inspirational story of someone who started by assembling computers and rapidly became a group CIO. And our session today, we will understand how it was shaped, what philosophies, styles, principles he used. So Kumar, before we start talking of the serious things, let's get some energy going up. Let's use some ice breaking. Please share a powerful incident from a mentor that brought home the point of making you indispensable and being process focused.
Sure, absolutely, Jagdish, and hello everyone. So this incident was with my first client in the US. The client was an oil and gas company based out of Houston, Texas, and they used to run. They used to manage land rigs and ocean rigs in the Gulf of Mexico. And being the data center lead, I used to manage the entire application landscape and ensure that the performance is optimal, because any something goes wrong and the rigs, then the operations get affected. So it's very sensitive operation. So that was the context. We had a change in the management, and one of my the IT director, his name was Bruce Smith. He always calls me son, and he had actually come from Enron background. So Enron was one of the largest energy giants, and we know the other side of Enron, but. The relationship was, I would say, absolutely great. And every day he used to either advise or he used to scold me. So that was the daily dose that was always required, which without that both of us cannot exist, right? And I never took anything like that, I took everything in a positive sense, and one of the quality that I learned was how to be malleable, how to be flexible, how to listen more, how to understand your boss, their perception or their expectation. And this was an incident where he was following me, up with the disaster recovery documentation, the entire layout, how applications worked, how the failback happened. And I didn't find time to do that. And he took me privately to the data center, locked the data center, and he said, "Son, um, do you know what risk is out there if you don't submit this documentation?" I said, "I'm working on it." Then he said that, he has a very colorful way of scolding me, as I would put it that way. And but then he told me that, imagine a situation that you walk out of this building. The moment you step out of the building, you are hit by a bus. You die. What happens to the organization? I think that incident really shook me up, and I it left a very firm impression in my mind, and that day I would definitely call it as one of the turning point in my life, because as a responsible IT person, it also drives home the point of how we need to document each and every part of the overall IT landscape, so that the organization is not, I would say, organization is not people dependent. So we are creating a process and driving the process, making more process driven rather than people dependent, right? So when I say indispensable, not make myself to make myself dispensable, which means that creating the right structure, having the right policies, workable policies, ensuring that there are processes, procedures, periodically tested. That was the most important incident, which basically turned and helped me to look at documentation, focusing on documents. So doing things technically is not the only thing, but documenting those aspects and ensuring that they are up to date from a time to time goes a long way. So that is one such incident that I remember.
No, absolutely. And like, I think, it really drove it very hard when he said, if you get killed. And I think there is a very, important message here that we always have to look at, am I being a risk to the organization? If I'm doing my job, well enough, keeping things documented, having someone in the know of things, and having set up the organization processes, etc. Then at least personally, I'm not a risk to the organization. Something happens to me, I'm not no longer a risk. And actually, you know what? I mean, I have seen there is a positive side of it, Kumar, that if you are able to do that, I think very easily you can actually go to your bosses and say that, give me something bigger or give me something more. And
Absolutely.
this exactly happened with me when I developed my backups. I was managing CRM, and
Mhm.
very, very intense one. And I found a good successor. I groomed him, and he was like all ready to take it up. And then I went to my boss and said, I want a different role.
Mhm.
It so happened that within a few months, the CIO role opened up, and I transitioned into that role without really any kind of overheads, coming from CRM. There was someone who was already taking care of it. But if I
Absolutely.
wasn't dispensable, then maybe my boss would have to think twice about offering me that role, right? Because CRM was like a new program, very, very important from a business point of view and all that. But
Absolutely.
thanks for sharing that, Kumar. I think that really brings home a very important point. So, Kumar, before again we go to your stories, I can see a lot of comments out here. So let me acknowledge that we have CXOs, founders, IT managers, and seasoned technology industry leaders in our audience. All of us know that technology is necessary but not sufficient to drive business performance. And guests like you on Clarity Chat have built the bridge between what is necessary and what is sufficient with their art of managing technology. And Clarity Chat builds the bridge between your learnings and all of our audience, who are trying to make a powerful impact with technology. So thank you all for joining us for the last 1 year and more, and encouraging us with your interactions, questions, engagement. So let us see who all we have here. Meanwhile, those of you who are silently listening, may I request you to share your name and where you are joining from in the comment box of YouTube or LinkedIn. So let's see who all have joined here. So we have, well, right there, the number one hand up there, Amrinder. Hey, thanks, Amrinder, for joining us very regularly. You've been a big supporter, and thank you for that. So you have Nitin Kumar Singh. Thanks, Nitin, for joining. And hey, Kumar, if you know any one of you, any one of them, your colleagues, past colleagues, just feel free to chime in. Okay.
Sure, sure, absolutely.
Okay. So we don't know who the LinkedIn user is. Maybe just put your name out there. You have Sunil Punjabi, again, a regular audience. Hey, Sunil, I hope you're doing okay.
Prashant
Um,
is there. Mayank is there. Hi, Prashant. Hi, Mayank.
Hey, hi Prashant. Hi Mayank. Yeah, Mayank himself was here on the Clarity Chat earlier. So thanks, Mayank, for joining.
Thanks.
We have Thakur
Nope.
Kishore Kunal Singh. Hey, thanks, Thakur Sabs, for joining. We have Bipin Joshi.
Anoop.
Yeah, Bipin, thanks for joining. We have Anup Upadhyay. So, your colleague?
Yeah.
Hey,
Anoop Upadhyaya. We have Sanjit, who is my colleague from the Software Development Center. Vikas.
okay, yeah, I can see Vikas here, Sanjit here. Hey, thanks, guys, for joining us. We have Vishwa Vidit Singh from Rockwell. Hey, thanks, Vishwa. We have Kapil Shukla joining from Singapore. Thanks, Kapil. Kapil is a classmate, so thanks, Kapil, for joining. And we have Sujit from Pune. Hey, thanks, Sujit. And yes, we have Satya from Texas. Hey, thanks, Sats, for joining us again. I know it's early morning for you, early Saturday morning. I'm like, I wonder, do you not party on Friday night? You're there in the morning. Okay, guys, keep it coming. So let us start grilling Kumar now. So, Kumar, let's begin with a quick recap of your childhood, right up to your first job.
Sure. So born and brought up in Chennai, I would say hot, humid, city of Chennai, and did my initial schooling in Giladarsh till 10th standard, and The next couple of years I spent in the 11th and 12th grade. I did my schooling in Dayanand Anglo Vedic School in Chennai. Mom being a teacher, she was all there throughout my journey, right from LKG to 12th. I was so heavily guarded, and mom is a stickler for discipline. You know how teachers are, I used to be that Sida Sada Ladka, studious. I would just razor focus from a study standpoint. Um, Came out of did pretty well in 12th grade. Got admitted in another highly disciplined college, which is called as Satya Prakash Engineering College. It's not much of a difference between military discipline and Satya Prakash, but I think it all helped in a way, I would say. And 4 years went past. I specialized in the field of electrical electronics. In the fondest hope that I would climb all those high tension lines, climb on those transformers, take my pack of my screwdrivers and repair all circuit breakers and everything. Because I always used to, look in awe of those, the electricity guy who comes in, who puts the fuse and everything, right? So it was always there, but unfortunately, I didn't land up in such a job. But college life was extremely good. Lots of fun, lots of activities. But one gripe with electrical electronics, it's 4 days in a week. You have to always wear khaki uniform, so you almost look like an auto rickshaw driver. So, but then it was pretty good, I would say, from a college standpoint. Once I finished college, fifth day I was bang onto a job. Started my career as a computer assembling engineer. Right. Though there were many avenues, my mom wanted me to do higher studies. I also had wanted to do, but then financial situation. Being a single parent kid, a lot of medical issues at home forced me to, or I wouldn't say forced me, but it made me think that I need to step up when the family really requires. And I was the only healthy kid, and and my mom had in all her life she has slogged like crazy. So it was time for me to step up, and that's exactly what I did. So I got into a very small job as a computer assembling engineer. Um, and but then the I would quote three specific incidents, right? Because life was not been that smooth for me right from the word go. But then there are three such incidents which I would say that which helped me mold in a much better way, much better way. Brought out a lot of toughness in me, right? And the first incident was being finishing a job, you're finishing up your engineering, seeing all your friends getting into software engineering positions in Satyam and other organizations. But here I was for lack of guidance, or I would say maybe I just took up a position which I said that okay, let me give it a shot, right? Why not? Computer assembling engineer for 600 rupees per month. That is when I started, the lowest of the level, but never thought like the lowest level. I said, okay, there's something to learn with an IT firm, and started assembling computers, pulling cables, network cables. You have to almost like an electrician work, crimping cables, testing. Taking my bike to do UPS service, computer delivery, whatnot, right? That basically brought in, to understand that, okay, there are, if you are able to put that hard work, which I'm definitely talk about it later, if I'm able to put that hard work and if I'm able to put that right commitment, and there is definitely a good result that we can actually get. The second one incident was, so I joined this after a year and a half stint in Landmark Infotech. Then I moved to IT 365 Private Limited, where I was technically okay at that time, but then I still had to take up a call center job, which means that we have to I have to take the call and say, "Welcome to ITSC. How may I help you?" Right? Never shied away from doing that, because if that is what needs to be done, it's the right thing, right? It's a job. So took up the job, graduated, rose up the ranks, came out very successful. That basically also showed that it's okay to start from scratch, even though you're technically qualified. It doesn't really matter. It's if people want to want you to prove sir, something. Yeah, it's okay to take up the task and do it. Third incident was when I was in when I came back from States, and I had to, for some visa issue, I had to return back from States. If I had stayed back in TCS, I would have again gone on site and all that, because my visa I exhausted my 7-year period. But then the intense desire to succeed. And when I came to PwC India, again, it was, though I was at that time a lead architect, technically I was like a senior technical architect, I still had to start as a manager. But all that rising up the ranks, gradually moving up the ranks, and working at each and working my way through each and every phase, right, has taught a lot to me, personally as well as officially.
No, absolutely, absolutely. So I think, Kumar, just to recap, yeah, I don't think you ever compared yourself with anyone else. Uh, Otherwise, you wouldn't have pushed forward that way. It's like, whether I'm assembling computers or taking calls, it's work, and the hard work pays off. So the second thing that comes out is like, your faith in hard work and commitment and doing the right thing, at the given moment, that that will always do good for me. So there was that faith, that you had. What needs to be done needs to be done. And I think you said it very nicely that, it's okay to start from scratch. It's your hard work, it's your commitment, and, it's your, what do you call, whatever else you bring to the work in terms of excellence, that is what is going to define where you land up, right? Which is like, I think yours is a story which is very, very clear about that. So Kumar, tell us more about your career, companies, roles, and maybe like, one highlight from each of those roles. Even if within a company you played multiple roles, just tell us about it, just to
Sure.
have a mind map of your career.
Sure. So June 2000, started out as a computer assembling engineer. Now I came, this was with a company called as Landmark Infotech. It was one of the subsidiary companies of Landmark Group Dubai. And I was assembling computers to doing servicing, network cabling, what do you say, doing network implementation, doing a lot of work on barcode scanning devices and all that stuff. That's when I learned, I would say, the trick of the trade, if I may put it that way. And that basically opened me the doors to the world of computers, but more on the infrastructure front, right? Then 18 months over there, fast forward, 2002 February, I joined IT 365 Private Limited. Now it is called as Scope International. It was the IT arm of Standard Chartered Bank. And this IT arm, we used to take care of all the banking applications across, India, US, and I would say the Standard Chartered Bank across the world, which means that we used to handle, credit card management system, banking applications, global markets. So I would say it's mission critical applications for the bank. Joined this as a customer support executive. So big calls. I know the pain of contact center executives. I was one, but worked my way up. Became a technical support. It is a big thing to get into technical support, especially from a banking standpoint. 6 months I was promoted, and then I spent another 1 year, doing, I would say, exposed to amazing set of technology from a banking standpoint. So close to some 450, 500 applications, multiple data centers. That's when I learned a ton of stuff, and I was super thrilled at looking at the back, working in the banking environment. But then the intense desire to always work for one of the leading IT companies, which was Tata Consultancy Services. So I joined TCS in August 2003, started managing delivery center for TCS. But then those days it used to be like that 1.5 years, tremendous amount of I would say, if you put in the hard work and if you're diligent, if you're committed, the onset opportunity always follows you, right? So the next 7 years, from 2005 April to 2011, I was in the US, worked with a number of Fortune 500 clients. The first one was Pride International in Houston, where I worked as a data center lead, and that's when the incident that I first narrated happened. And I did really, really well there. And then I said that I need to take up another opportunity, something which is which pushes me, takes me to the next level. And the next 3 years I spent in Lexmark from 2007 to 2009, or I would say 2006 to 2009. I was in Lexmark International as a global IT architect. What started out as a 3 months engagement span for 3 years. Did phenomenal amount of work. I was in the client side, though TCS had won an engagement with Lexmark. I was the global IT architect over there. Then I said, okay, 3 years enough. I need to learn more, and I pushed myself. And then I said that then an opportunity came to me to work for Cisco through TCS. I was a technical marketing engineer, so I was part of performance benchmarking, spec benchmarking, worked with Intel, EMC, VMware, a number of other leading technology companies based in the Silicon Valley. A year and a half over there, I said that I've learned a lot. I have done so many things. Now I think it's time to give back something to the organization. So I went, 2010, late 2010, if I'd been in Cisco, I would have stayed. I could have stayed there forever. But then I voluntarily came out. 2010, late 2010, I said that let me get back to TCS and do something really good, contribute to the practice. So I gave back to the organization. Started out as the practice lead for Cisco in TCS. From there, because by that time people knew me, who I was, what I was doing, that technical expertise. I was noticed. I was called out, because of the work that was actually done. So travel to Canada, travel to London. So when you're really good, when you're committed, focused, if you're super focused, I would say, then automatically clients call you. I've said I've handled engagements without even knowing what I was, what was that engagement about. But then learning on the job, because that intense desire to succeed in life, no matter what. So that was what basically helped me to, grow up in TCS, got exposed to multiple clients in TCS, by working from Edison, New Jersey. But then I said that, okay, 9 years in IT services is a bit too long. But TCS was never, they never wanted to leave me. But I forcefully came out and took up a role in consulting. Career completely took a good turn. I would say it was the perfect pivotal moment in my from a career standpoint. So I was able to fork out and take up a consulting role as a manager. And in 3 years, 9 months, I came out as a director for emerging technologies, which means that started a small cloud computing practice, handled several projects, and it came out as a lead. And then NH was my client. So then NH happened. So from 2015 August till date, I'm with NH. So I've completed 7 years at NH as a group CIO. But so this is the last 21 years of my work experience.
Awesome, man. I think that's the blazing trail. I think 2000 you started, in 2015 you became a group CIO. I think some of the things that I noticed here, uh, as a customer support executive, I noticed when you said I learned a lot, 400 plus applications and so many technologies and all. I think for someone to be typically, people would look at, hey, I'm a customer support executive, I'm answering calls, and I'm like, handling these cases and all that, and like, there's somebody else doing something better. But I like the way you approached it from a learning point of view, and I see that, that pattern. The other pattern that I see is, no fears, no conditions, no preferences, whatever it takes, whichever customer wants me, go there, do that. Many times I have seen people getting locked on to, like, a place, or a certain type of customer, and having those things that, no, this won't work, this will work, and all that. I think you've been pretty free and unconditional in terms of, like, in terms of going out and gathering experiences, serving customers and all of that. I hope I got that right,
Yeah,
Kumar.
absolutely. And if you don't push yourself, if you don't, then that learning will never be there, right?
Absolutely.
And the best way to do that is to stretch, keep pushing boundaries, and that's what made me learn so much. I would say, but it's still a lot is left to learn, I would say.
Absolutely, absolutely. So Kumar, I mean, that brings me to my next logical question, that, you've always been a sponge for knowledge and experiences, as we can kind of figure out so far. Always
Mhm.
being hands-on, hard work, strong value system. So share some of the intense experiences that you went through when you built your career. You have shared a couple of them, but maybe, like, feel free to add more to that with the specific incidences.
Sure. I think, yeah. So I will narrate a couple of 2 or 3 incidents. So this was my when I got onboarded to Standard, to IT 365 Private Limited, which was the IT arm of Standard Chartered Bank. Um, I was exposed to. They said that you're going to be in customer support, but if we find you good, if you technically equip yourself, then you would get onto technical support. So there is no. So the only way to get into that is to show I would say technical superiority, which means that you need to talk the technical banking language. That language. Be it how do you handle a credit card management system, how do you release a job, how do you handle a mainframe and everything. So we used to literally, I would say, or me and my other 2 or 3 other friends, we used to literally spend our night out in the office, which means that we had a night. We will make our customer success managers to give us a morning shift, which is 9 to 6. We will finish that, go home, have a shower. Mom will give dinner. She will ask me, where are you going? I say, I'm going to the office. He said that you've just worked and came. What is actually there? She I think she had her doubt, saying that I'm going for a movie or something like that. But because because I've seen money, right? So moms always have programmed that way. But I said, no, mom, I'm going to the bank. I'm going to learn. We're setting a lab. So we literally set out labs with whatever infrastructure that we had. We set out labs. We used to mimic certain, technology environments and see how it actually works. So the best way to, when we had to learn something, there were these development environments are there which we used to set up, and we used to learn through that. So I've done pretty much one almost for 6 months, or I would say 6 months to a year. Literally slept on the office floor. 6 o'clock, first shift starts. Contact center manager will come and say, Kumar, wake up, go home. 9 o'clock is your shift. Then we used to wake up, go home, have shower, breakfast, come back again. That was absolutely fun. But then we learned a ton of things rather than just writing some certification and doing something. We literally set up environments. We broke the environment. We used to go to the data center. We used to understand how issues are being troubleshooted, learning from seniors. All those actually made me a better person to understand things. So this was actually one point in my life where I said that that's what I said. If I hadn't pushed myself at that point in time, I would have never learned it. I would have been happy with a customer support executive, right? So that was Standard Chartered Bank. In in TCS, right? First assignment was to manage the Sonex Towers delivery center. It had 26 accounts, and these delivery centers are all massive in the sense that they have their own developers. There was prudential account, there was engineering accounts, and everything like Martin Baker and all that stuff. So we need to provide provision infrastructure, take care of their applications. I knew zero about all this because coming from a banking environment, I was in that nice cushy chair. Now we have to walk down, meet with the practice leader or we call it group leader and everybody, and understand their issues. I was given two trainees from college. So I was the only person. I was given two trainees to manage that, 26 accounts, and managed everything to perfection. Which basically, so we were one of the best delivery centers. We were able to maintain more than the committed SLA. We were able to ensure that all 27,001 processes and everything was actually followed. And that basically was the launch vehicle for my on-site. So proved by performance that somebody, even a 3-year experienced person, can handle handle a large delivery center at ease with just two trainees. Never have complained to my manager saying that you've just given me two trainees. I don't generally complain, about, but making the best use of resources in that process, teaching both of those people, the nuances, of technology, and helping them come up the ladder. And the other incident was with PwC, I would say, where where we were never partners for anything, right? Pretty much, when cloud computing was its infancy, if I may put it that way, talking about cloud, convincing customers, on assessment and strategy engagements, talking to them about design, talking to them about architecture. Many things I've learned on fly, and in that process, winning engagements, converting an assessment to design, design to implementation, implementation to an operations engagement was that bigger cycle, right? And in that process, when I look back in PwC, in a very short span of time of 3 years, 9 months, did around executed around some 75 to 80 projects, spanning strategy to execution. And the most important thing is in PwC, if you have to, I would say in PwC or any other consulting company, if you are going to a customer, you need to build your own tools, which means that the collaterals or the intellectual property. So we came up with a tool to compare products. With a Six Sigma tool we used called as Enterprise Pew Metrics. We had a tool to assess cloud migrations. We had a tool to evaluate, IT governance. I've undertaken risk assessments for a leading airline, based in UAE, not knowing anything about risk, but then learning, understanding, and quickly coming up to speed, right? At the same time, making sure the customer get the desired output, and that I'm able to contribute to that organization in a meaningful way. So those are some of the incidents, that I went through.
That's awesome. I mean, I think there's nothing. I haven't come across anything similar. Where someone spent 6 months in office, literally 24 hours. Just to rise up from being a customer support engineer to a technical support engineer, and then doing everything that it takes. So, Kumar, just one question. I think this one theme comes to very, very strongly, that your hard work and your hunger to learn, even in your PwC, right? Being a technical architect and infrastructure person for all this long, moving to consulting, taking that risk, and then learning your way, and getting promoted every year. So. Um, so this basically tells that you've got a huge hunger to learn. But then, how have you mixed the formal education with this learn at work?
Sure. No, I think, so I've been a lifelong learner, still learning. If I don't learn, I feel insecure. Maybe it's because of my mother, because she's had some 9 or 10 degrees to her name. So how did I, one is in the initial 7-8 years, acquiring a lot of technical certification. That was very important, because doing a certification not for the sake of doing a certification, but doing a certification, and many of these certifications I would have done, I would have executed similar projects in for customers, and then I would go and write the certificate, which means that I never had to put too much of effort on studying, because I've already gone through that entire phase of implementing a product or implementing, the 9 yards of that. And then I used to take up these kind of certifications that are there. So in that process, open group architecture framework, then multiple VMware certifications. Cisco, if you're in Cisco, you have to write those Cisco certifications. First client, a lot of Microsoft certifications. But then when I was in PwC, consulting, you have to speak the consulting language. You have to reprogram yourself, which means that the mindset have to change. So I took up an executive education with the Indian Institute of Management, Bangalore, and that actually not only opened up from a network standpoint, but then opened doors from a management standpoint to understand that world in a much better way. How do you pace the conversation with leaders? How do you basically open up conversations? So that was the IIM stint. When I moved to NH, you have to speak the hospital language. So I said that, why don't I do a post-graduation in hospital and health systems management? So enrolled in BITS Pilani, and successfully completed that. I did a final year project on health information system quality, which is highly acclaimed, scored a grade of around 9.1 out of 10. Mom was finally proud that I did a post-graduation. Otherwise, she used to always look me up as, oh, you're just a BE, right? She's a doctorate in emotional intelligence. But and then I took my certified information security manager training, or I would say certification. I did a public speaking course with Derish Mohan, because how do you convey a story? How do you tell a very compelling story? How do you then speak at ease? And now finally I've next 2-3 years I have to finish my post graduation in cyber law and cyber forensics, and I have to finish my doctorate in digital health from Chime University. So that's the plan for now. First finish the doctorate, and then look for other things, right? So that's been my learning experience.
That's an amazing one. Like in the beginning, you have done all the work, and now you want to validate whether, whether you have learned everything or not, and then you do a certification, and then you fast forward. You are trying to understand, what will it take? What is the best way to do it? And if that means, going for, let's say, an IIM Bangalore executive education, etc., you're doing that. So that's an amazing story. And I think again and again, I always tell people and mentees that you invest in the horse, the cart follows. And I think yours is a very strong example that that you invest in learning, invest in capability, which is the horse, and the roles and the compensations, etc., will follow. So, Kumar, next, let's when we were having our prep chat, I saw you talking with a lot of gratitude for your mentors. So, and mentors play a very, very important part in the real life learnings and the real life nuances which you cannot get from books, right? So tell us a couple of examples or a couple of incidences from your mentors. You have told already one or two.
Sure.
Yeah. And what did?
So my first mentor was Shiva Sen, who's now with Tata Sons now as a vice president. Again, he was mentor to me in Standard Chartered Bank. Supported me heart and soul when I was. So I, from him, what I learned was how to respect juniors, how you need to put a hand on their junior shoulder, understand their problems, and motivate them, and help them navigate the technology world. That's what I learned from Shiva. Steve Clark, who was my client director in Lexmark account, from him, he gave me the entire virtualization project. So from him, what I learned was how to place trust in people and give them opportunities, so that they will be, and support them throughout, so that they can be successful. So that was one big moment for me, which in that engagement. In NH, Dr. Shetty, he's a living god for us, and never seen such an amazing person. From Dr. Shetty, what I've learned is, can be he's one of the most celebrated person, right? Very well-renowned doctor. Technologically, he speaks technology. So much of technology oozes out of him, right? But always been so much of humility, even though he has this aura around him, right? That humility, that's what I learned from Dr. Shetty. And as mentor, he's been coaching us, he's been guiding us in the last 7 years. Last but not the least, my mother, who's been an epitome of hard work and courage, braved against all odds in life. And today, if I'm at this position, it is definitely because of her. Because without that, I've never. But taught me a lot of things, of saying that there can be dull moments in life, there can be several issues in life, but it is that she always used to say that this too shall pass. It's all storm in a teacup. Chin up, my boy, and things will be all right. So these four people, I would say there are many more, but then these four people have created a great impact in my personal as well as my work life.
That's awesome. So now my next question to you is, like, how are you paying back, or rather paying forward, and how do you manage people?
No, I think three or four quick things. One, you always give a helping hand to people and pull up people up in the organization. Ensure that if we have actually undergone, so for me, a lot of people have actually helped, and help me to climb up the ladder. So support people, understand their challenges, get people up the ladder. That is very important thing. Don't be protective about your chair. Which means that decisions have to be taken in absence. What this actually means is make yourself dispensable, which means that you're available for other roles. You ensure that you're creating a process-driven, but a people-friendly organization. And then the innate need to create a change, understanding and working shoulder to shoulder with the team. Because when will juniors actually respect you? Only when we start rolling up our sleeves. Leaders have to roll up sleeves and start working along with people, rather than sitting on a chair and ordering. That doesn't work. So you will gain respect from people only when you are able to demonstrate that. Then people will automatically start working for you, and you'll be able to deliver results.
Absolutely. So pull up people. Be a custodian of your chair, not the owner of your chair. Make yourself dispensable, and finally, roll up your sleeves from time to time, and let people know that, that you are also a contributor, not just an order giver. Those are some really awesome philosophies, Kumar. So, Kumar, let me. But before I ask you other questions, let me invite everyone in the audience to ask questions to Kumar. So please go ahead and ask your questions. Let me browse if there are already any questions. I did see one question from Amarinder. Kumar, while we move to the NH, experiences, here's one question from Amarinder at a slightly higher level. So, a question to Kumar KV: is there an equation between number of beds in a hospital translates into XYZ level of IT maturity in a hospital chain? And if time allows, what would be different, exciting in healthcare IT in 2030?
Sure. So I don't think there is any formula between number of beds in a hospital and XYZ level of, or from an IT maturity standpoint. Because even though if you have some 2,500 beds, 4,000 beds, that is actually there. It all depends on how much you actually invest. So I would say a good thing to be to assess, if you want to say at a high level, if you want to assess the IT maturity, look at the percentage of IT budget as from a as when compared to their overall revenues, or their or their overall revenues. That can be a good measure to understand how much they invest in IT. So that can be one way of determining IT maturity of hospital. And what would be different or exciting in healthcare IT in 2013? The continuum of care is actually changing, which means that the providers are not confined to the four walls of the hospital. The wellness, the connected health part has actually opened up the doors, and we've seen from the pandemic itself. So the hospital, like Dr. Shetty always says, is the hospital of the future will have only ICU beds, which means that hospitals will be more niche, which means that the care will slowly, move home. And we've already seen this transition happen because the future consumer or the future customer, does not want to get into an illness, which means that we have to manage their wellness, or even if wellness leads to an illness, then we have to manage through connected health. So it will be truly digital health, which and providers will more and more focus on doing niche things, and effectively care will get delivered at home. That would and with more amount of data actually coming, more amount of digital system decision making, clinical decision making systems will become smarter, better, faster, which means that to diagnose, treat illness, I would say it will be much better. So that's my reply to Amarinder.
That's awesome. That's awesome. So, and I think we have seen this in the pandemic that there were many home care packages which were created.
Correct.
And so we saw remote consultations happen in a big way. And you're right, like unless you require something, unless you require any kind of procedure or something which has got a specialized equipment in the hospital, you probably don't need to go there.
Yeah, absolutely.
Okay, so Kumar, let's now it's a good segue to to talking about Narayan Health. So Narayan Health has a transformational vision. Of course, I've read the case study. You live it every day, but to many of us here, they may not know about it. So please share this with us, and very importantly, from this discussion point of view, I think it's also a great example of how you align technology strategy to organization vision and strategy. Yeah, please share what's happening at Narayan Health and how is technology contributing to it.
Yeah, I think we firmly believe in providing high quality, affordable care to for a broader population. And in a country like India, where the nurse to patient ratio, the doctor to patient ratio, the bed to patient ratio is so skewed, we firmly believe that technology will act as a force multiplier to ensure to basically bridge the gap in care, right? And what the pandemic has actually taught us, as I said, the future customer wants, does not want to come to the hospital. Instead, they want us to manage their wellness, and even if that wellness leads to, even if they are taking care of their wellness, but somehow it leads to some illness, then they want to ensure that they are, through connected health, we manage that illness in a much better way and ensure that they are able to live quality life. And what this change in mindset, or this opportunity that has actually opened up, has makes providers to invest in a lot of new digital technologies. And we all know that digital is a journey. There is no destination. There are only several stops where you assess, understand how things need to be done, and start moving forward. And at Narayana Health, based on the broad vision that we have actually set to provide affordable, high quality care, we ensure that we select the right elements from a technology standpoint, and and that's how our digital, the guiding principles that has been carved out as design for failure, so that nothing fails. Whatever we plan, any solution that we plan, has to ensure that focuses on, from a patient engagement standpoint, any initiative that we do, or any business technology initiative that we do, has to ensure that the data is actually available for making insight. And once an initiative is actually completed, we ensure that there is proper benefit reviews that is actually done to ensure that it is aligned and it is delivering the desired output, right? So outcome focused approach. And so our digital transformation journey started out in late 2015, and we said the first 5 years we spent executing a number of initiatives, over 150 initiatives so far. So I would say 2016 to 2017 was laying the foundational platform for the future, where we cleaned up a number of things. 2017, we said that why don't we take control of our own destiny, which means that how can we build technology superiority. So we carved out the software development center. We have around 155 members strong team, where we build at least the next generation, healthcare EMR products. And we are not only a technology provider, a healthcare provider, we are also a health technology provider too. And we built a healthcare information platform in 2.5 years, rolled it out in the phase 3 of our digital transformation. We rolled out the entire product across all our facilities in record 10 months. In the history of any HIS rollouts, nobody has seen something like this, which means that we were able to model the entire methodology, or we use a methodology called as transform methodology, which I learned in PwC. We modeled that, and we were able to understand, or the learnings out of each implementation, and we were able to seamlessly roll out across all our hospitals. The next 3 years, we are focused on transforming patient experience, doctor experience, and administration experience. And we hope that if we are able to do this, we will be able to create the desired change, in the healthcare landscape.
Okay. So, you just mentioned these very, very matter of factly, Kumar, the principles, the IT principles that you have. But I just want to, I took a note of it and I wanted to elaborate on it. So, you said the design for failure, like that means, it starts with a resilient architecture. If your operation is going to be more and more technologically dependent, then you have to design for failure and you have to make it design for resilience. I think the second one is very important. You said design with patient in mind, right? So that's user-centric design of your systems. Then the next one was data is available for insights. So make everything data-driven, and it is not as easy as it sounds. Because I remember when we were doing our first, CRM project, and I was coming from business, I realized that this whole master data that was coming was not designed from a hierarchy point of view, from a categorization point of view, and there was a lot that we had to do to make it analytics ready, and and set up sort of a master data small team itself to make sure that the data that goes to analytics has the necessary level of hierarchies and categories and all of that. So, and I think the last one is the most important one, which I keep talking about, and which I also instituted in my own way, which is the benefit reviews. So the programs go live, don't think that they are successful unless you see the KPIs moving or the benefits being delivered, or even, let's say, for example, somebody's satisfaction level moving up, and I think what you mentioned again, the right digital transformation roadmap, that it does not start with just putting some apps out there. I think the first part is always that transforming your technology infrastructure, or building the foundation, and then using that to transform the experience. So some really interesting insights there, Kumar. So Kumar, maybe shall we move towards the rapid fire, unless you want to talk a little bit more about Narayan Health?
No, we can move to that.
Okay, fair enough. So, we are done with our questions. Let me see if there is any questions from the audience. I did see one or two, so let me bring this up. So, Sets from Texas is asking, how did luck play a role in your career?
No, I used to say that my, that numerology or something. If you see, if you count all my date of birth, the number is eight. So, which means that number eight means you have to work very hard to earn your bread. So, I don't think there was. I was. There is no. I don't think there was any luck. But I had. I was surrounded by good people. So that was never luck, I would say. But maybe you can call it luck. Also, being surrounded by good people, good mentors who helped me climb up. Or help me come up this far. But then, even with luck, you have to sweat it out. Unless there is no pain, no gain. I would put it that way. So I
No,
really.
absolutely, absolutely, Kumar. So, Kumar, I just want to pick your brains on that one. You said that I was surrounded by good people, but definitely everyone you were working with didn't feel the same way, isn't it?
Uh,
I mean,
uh,
what I mean is that the statement that I was surrounded by good people is a perspective and outlook within you, not in general, that wherever you worked with, the people were good, because I'm sure
yeah.
there was a lot of politicking around. I'm sure there was a lot of backbiting, but you were
Mhm.
not doing it. You were looking at it like, with
Yeah, we
there's
always see the good in people. There are always negativity around. There are always all these other things around distractions that are actually there. But you always see the good in people. That's what I have learned over the years. See the good in people, and it's a very small life. So try to forge a healthy relationship, and move forward.
yeah, and ignore the negatives.
Yeah.
Very important. Absolutely. That really resonates with me. Like, when I mean, somebody asked me, I probably give the same answer that I've been always surrounded by good people. Yeah. Okay. So there's another question. So maybe we can make it rapid fire. Many hospitals want to custom build HIS. Is that wise?
It. Thank you, Bharat. And no, I think it's not for the. No, many hospitals do have an aspiration of building their own HIS. I would say don't get into that territory because. But if the provider truly has technology ambitions, we had certain technology ambitions. We firmly believe. We have always believed in technology being a force multiplier in delivering healthcare to the masses, and that's why we took that route. But if I would not advise other hospitals to take this route because it's never for the weak-hearted. There are so many complexities involved, and when you build these kind of systems, it needs to you need to ensure that you build a human-centric. You approach you have a human centric. You create a system which has a human centric design, right? So that is very important, and many softwares don't focus on that. So the question, so don't venture into that area. But if you have real good technology ambitions, then build an EMR, I would say.
No, that's great. That's great. Yeah. Yeah. I think, you have to look at, like, how much are you really a technology user, or are you also a builder? In your case, you decided also to be a builder, but not
Absolutely.
everyone.
Absolutely.
So I take my last question before I move to our rapid fires, Kumar. So this is Bhupendra from Oman. He's asking, in the healthcare field, while providing high tech, how do you make sure there's high touch as well?
What is high touch?
High touch means, like, the more caring and
No, so I
touch
think
point.
yeah. So even though even if there is a lot of penetration from a technology aspect, I think this is healthcare is definitely a human intensive field where people definitely look up to that nurses, doctors spending time with them. See, what we are doing differently is today a nurse spend 4 to 5 hours in just chart doing entering data in a paper or filling up several forms. So it is we've understood that problem area really well, and we've said that how do we basically digitalize systems to so that 4 or 5 hours can be devoted to providing care for our patients. So the nurse workflow digitalization initiative that we have actually taken up will free up nurses of filling all those manual forms and enable them to focus on the patient and spend time with them, and ensure that the right quality of care is provided. For the doctors, what we've done is we have rolled out the doctor app, which is there, which will help them to not only communicate and collaborate within the community. We have ensured that we have a feature in the app where what is called as family communication. So when a patient is actually admitted and he or she undergoes a procedure, many a time the family waits for certain information. By bringing, how do you bring the touch? We have ensured that through the doctor app, and the doctor is also having a ton of work, right? How do they then sometimes they have to communicate with the family on the situation, on the status of the patient. So we've ensured that the family communication feature is there, where they directly call out from the doctor app, talk to the family, and tell them comforting words of how the patient is doing, or what is the approach that they're actually taking to bring him back to what do you say, a much more healthier position, right? So that is how we are actually looking at technology helping us or aiding us to make that high touch, right, and ensuring that more time is devoted for care, and that's been our experience, and that's how we are actually doing things.
No, absolutely. And Kumar, it so much resonates, in my experience. I just want to like give a sort of a patient or relative, perspective of it. Um, you know, last couple of years, like, we were like doing rounds of hospital. My brother-in-law was fighting cancer, and he lost the battle. But then, like, in that process, I got to sort of understand, study a hospital much more closely. And what I realized is that, it's a very regulated entity. Okay. And therefore, there's a huge amount of documentation, there's a huge amount of record keeping. And, a lot of your staff time actually goes into doing that. What you said, right? Filling up of the forms and everything, right?
Sure.
And then again, like, this there's always this one thing which is at the highest premium, which is doctor's time. So how to make the most effective use of it. And I'm like, what you just narrated kind of gave me an aha that, what, the more and more technology you use, the more and more you can take away many of these challenges which come because of regulation, record keeping, and everything. And the more time it can free up, for patient care, and like, those comforting words to relatives. Okay, so thank you everyone for your questions. Now let's move towards the rapid fires to Kumar. This is really an interesting element or interesting part of our chat, and so interesting that we have actually started converting our rapid fires into those small 4 or 5 page nuggets, and started publishing them separately. So, Kumar, what would you have been if not a CIO?
Cricketer. I was always fascinated by cricket. Played in under 11, under 13. I was a fast bowler, so this missed out because of I had to focus on studies.
You missed out on a Bumrah, a future Bumrah. Okay. So you transitioned from a consultant to a CIO. What's the biggest difference between a consultant and CIO? And you've been on the both sides.
Very tough, but consultant and CIO. Consultant is more of you have to plant an idea and grow the idea. CIO, you have to listen more. You're in a much more responsible position, so decision making becomes very important. So that is what I learned.
Sure. Okay, so let me ask you a follow-up rapid fire on that. What is the relationship between Inception movie and your role as a consultant?
No, so you have to. The thing is, we many of the consultants, consulting companies, they're not partners for any technology products. So when I was there, it used to be like that. So we have to go and talk to the client, understand what their problem statement is. The first question is, what is your problem statement? What is the current challenge that you actually have? Many a time we fail to ask that question. So understanding the problem statement and trying to see whether if we can plant an idea of how we can actually address that, because because we used to come from one of the big fours. They used to say, oh, you are all from big four, and they will tell something and go. But then we used to ensure that we understand the problem statement, plan that idea, or even if they didn't have anything, right? They said everything was working well. We have encountered such situations, but then talk to them about something which is very relevant, plan that idea, grow that idea, talk to them, keep on talking continuously until you make them give that engagement. But once they give an engagement, NH was one such customer for me, where they gave a disaster recovery strategy engagement. You have to grow that business again. So it's not easy. But now that you have struck gold, now you have to see how you can actually, convert that into multiple projects. It is basically you have to find food for your other practices also, right? So that is the job of a consultant. So it is quite so that is where that inception movie basically comes. You have to plan, grow that idea, and sell that idea to them, saying that, and it has to come from their mouth. Yes, I need you to do this.
Absolutely, absolutely. No, I used to give this example to a lot of my team members that like we have to think like an inception, and in my case it was like to the business leaders again, who think that everything is going fine, everything. Then you have to put that bug of that inspiration in their mind that here things can be different. Yes. Okay, so Kumar, my next question to you. Um, you got promoted every year in the PwC. Three things you did differently than your peers.
um, like I would say, learning, supporting the team when it really, really mattered. Always stayed humble. So those are the three things that I did differently, which enabled me to get noticed by my superiors as well as my, gave a good feedback from my peers also.
I love the last one, staying humble.
Yeah,
Because many
absolutely.
people think that to succeed, if you stay humble, you can't succeed. But I think that's a good example that you can. Yeah. How's the culture at Narayan Health? How does it help you?
One is at NH, right? We always believe in empowering people. I'm a classic example of that. Management places tremendous amount of trust on me. So empowering all your leaders, they've done that beautifully well. Respect for all. That is one of our core values too. So respect for all goes without saying. Everybody, be it even a gardener to all the way to the CXO, respect for all is a must. Governance driven and democratic. So those are some of the three traits what defines NH, and that's why we are here.
Oh, that's awesome. Yeah. Kind of gives us an idea of like what it would be like to work there. Okay, so what is your advice to fellow CIOs?
You focus on your problem statement. Let's not sell technology to the business. If you're able to solve the problem statement, technology can automatically fit in. Always have an architecture mindset before you execute. Plan, architect, and then execute. Um, then empower people, lead from the front, and try to bring up a lot of people in life. Don't hold on to your chair. Play forward. And last one is perform actions without expectation of results. So that's my short advice for my CAs.
Oh, I think all the right ones. Empower people, architect. Start with solving problems, not with technology. All the right ones. Okay, so Kumar, we are done with the rapid fires. Thank you so much. Now, I've been asking you all the questions, so this is the revenge part of it, which is like your question to me.
No, usually, no, I think it's more of a question that So when are you going to give me an opportunity to interview you? Like you've been interviewing a lot of us, right? This is the 62nd, probably the 75th edition. You should allow us to interview you. You come with a ton of experience, so you're waiting for that opportunity, I would say.
Absolutely, no one gave me the idea, so definitely, maybe we'll plan a session where you can interview me.
Sure, sure,
Absolutely.
absolutely, Jagdish. Yeah.
That's great. That's great. Thanks, Kumar. And yeah, you planted a new idea in my mind now.
Yeah.
Okay, so that brings us to the end of our session. Yeah, we went 15 minutes over, but I never felt it. It was such an engaging session. Thank you, Kumar, for being very crisp as well as very informative. And thank you all our audience for attending and engaging. And I know a lot of you view this session afterwards over the weekend. So thank you, all of you who are going to be watching the recorded version or who are watching the recorded version right now. Please enjoy your family time. Yes, day after tomorrow, we are celebrating the 75th, Independence Day. So happy Independence Day to everyone.
Happy Children's Day. Yeah. Yeah.
And thank you, Kumar, for joining me on the
You're
Clarity
welcome.
Chat.
You're welcome, Jagdish. Thank you so much. It's been a pleasure. I really appreciate the opportunity. Thank you, and thanks for all the viewers who have watched this. Have a safe Independence Day. Jai Hind.
Thank you. Bye bye. Jai Hind.
Bye bye. Jai Hind.